Hello po, what's up guys? Ako po si Jericho Arceo. Andito po tayo ngayon sa CSA Medical Aesthetic Center para magpagawa po ng baba. So yung last ko pong experience dito ay ginawa po namin yung laser from Hollywood Spectra at saka nagkaroon rin ng facial after. So ayun, linaser yung mga kung ano man dati laser sa mukha ko and ayun. Masaya po. Ayun naman po, nakita naman yung result. Sana nakikita nyo, no? Ayan. Ayan, so don't forget to click like, subscribe, and click the notification bell sa Contessa Salvador-Alapag. Ayan. Subscribe.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. Today is another exciting day. We have a follow-up for Jericho Arceo. There you go. So we did Hollywood Spectra treatment with the MDF to target those acne scars and also acne marks. Okay, and we had 2 sessions, right?
Yes.
So we just did 2 sessions for Jericho, and we already noticed a decrease in those acne blemishes, and especially in the jawline area and the neck area, there's a decrease in the pigmentations. Noticeable, Jericho?
Noticeable po daw.
Right. And some of the pores, they were reduced already. Of course, we have skin pores. It's just that some people have these large pores, widened pores, but we want to kind of closely tight the, or what do you call that? Close them. Okay, then make them tightly closed. Okay. So for today, actually I did an assessment on Jericho in the past, the so-called the rule of thirds, okay? The upper third, the middle third, and the lower third. I noticed that on the lower third, there's kind of like a deficiency in terms of the length, the vertical dimension. And when I look at the profile view, the side view, okay, I do the so-called Ricketts E line here. So we notice that there's a deficiency also in the anterior projection of the chin area. What do you think, Jericho?
Yeah.
Right.
Yeah, doc.
Yeah, because in the chin area, okay, we have certain measurements also we follow, like the length, the width, and the projection, okay? So if you pattern it with the rule of thirds, the divisions of the face, upper, middle, lower, ideally like 1, 1, 1. But in Asia, we notice that most of like the Asians have a shortened lower third of the face. Like we have like shorter mandible. It's like in our in our genes. So genetic makeup, okay. It is inherent in us. Okay, it is not something like our fault that we had this. So it was already
Our fault.
In our genes. And then the others were saying it's the fault of the
My mom.
ancestors. Okay. What we can do right now is somehow improve it in a way that it will follow those like rule of ratios and proportions. We wanted to improve the anterior projection. We wanted to lengthen. We wanted to, of course, male chin, okay? Masculine chin, squarish. Ano bang shape ng chin mo, Jericho?
Oblong.
No. And I was also looking at the jawline area, the angle of the mandible here. I noticed on the right side, there's a good L shape of that, the angle of the mandible. But on the other side, the left, it's not the L shape. It's a little bit curved or rounded. Because for men, for a masculine jawline, we want it angled. We want it the letter L shape.
Yeah,
and square shaped jaw. Yan. Paano ba magkaroon ng sharp jaw or chiseled jaw? Or they say snatched jawline. You've heard of the snatched jawline?
Not yet. Just now, doc.
Snatched jawline. So we wanted to achieve chiseled jawline, squarish chin, improve lower third of the face for Jericho. We'll show you the procedure when CSA Medical Aesthetics returns. And we're back. So we're doing a so-called chiseled jawline procedure for Jericho. Okay, so we're working on the lower third of the face. Okay, so on this part here, what we want to avoid is the injectors. Okay, we want to avoid the branches of your facial artery, which comes out from your antegonal notch here. So it's the one in here, and then when you have your facial artery here, it actually goes upward in a like kind of twisting pattern, and then it branches off into your inferior labial and your superior labial artery, plus going to the upper there to the nasolabial, branching off into this inferior alar vessel, and then it's gonna give off the lateral nasal artery vessel up to the terminal artery. So for injectors, the facial artery branches are the ones we are avoiding, plus also in the mentalis foramen here, which is aligned with your supraorbital foramen here, infraorbital foramen, and here your mentalis foramen. So for injectors, those are the ones we want to avoid. Okay, and in terms of the anatomical tissue layer, when we do dermal filler injections, like we target either the subcutaneous superficial layer, fat layer, okay, or above the bone. So those are the important layered structures that we target with dermal fillers. So for our jawline improvement plus chin improvement, the non-surgical way, we use our dermal fillers. Okay, for our dermal filler, we'll be using the hyaluronic, specifically the Juvederm Volux. Okay, I love the Volux because it's robust, it's high G prime, and it really creates that good jawline or mandibular definition plus a good chin shape, and we can improve further for Jericho. Are you excited, Jericho?
Yes, Doc.
Super excited. Okay.
Super, Doc.
So that's just like kind of a review of for doctors.
For
what
board
we
exam.
want to like, of course, the anatomy, we have to respect the anatomy. Plus, so a while ago, we explained on the assessment on the lower third that we need to improve that. Now, as to the product I've mentioned, we'll be using Juvederm Volux or our hyaluronic high G prime product. And for the technique, I'll be using a cannula method technique. There you go. So we have our plan. And then for the chin area, okay, I'll be using, well, actually I could use 2 to 4 syringes on this part here. And then in the jawline, 2 to 4 syringes, okay. It will really depend on like the needed projection and the needed lengthening of the chin, plus the needed also jawline formation, definition to create that L shape, especially on the left side here, okay. So before procedures, we clean the area, we anesthetize with our numbing cream, okay. And then, so whenever I work on the chin area with the cannula method, I need to use a poker or introducer. I'll pinch the skin, Jericho, okay, just a tiny prick. It's just like when you're having your facial treatment, okay. So this part here, that's the entry point, and I have here my Volux, and using that entry point there, together with the cannula gauge 22, I'll just insert it in that entry point, and then I will just glide it toward the so-called deep sulcus, or we call this also like the labio-mentalis sulcus, okay, to be exact in our scientific terms, Jericho, okay. So many anatomical names, anatomical terms. So whenever I deliver this Volux here, I'll do a pattern, okay, to kind of like a semi-fanning pattern here, or the others are saying like a fishbone pattern here, okay. So it's normal to expect some tissue fibrosis here because Jericho had acne in the past, so we had some acne marks. Sometimes there are tethering bands of the acne scar, okay. You just want to glide it towards the sulcus there. Then you can spray the pain freeze to help with any discomfort. So again, this is the cannula, it's blunt, and I'm delivering it into that deep sulcus there. So just gliding. Then I'll be delivering as much as I can deliver into this anatomical tissue. So the amount of the product could vary from, like for example, this area you can give, for example, if you're using 1 syringe only, like half mil there, okay? So you can subdivide the product that you want to inject, okay? So there you go, just undermining the area, the tissue area. And then once you have delivered into the deep sulcus, or the so-called labio mentalis sulcus, okay? Because we have here labiomandibular on the other side there. So once you have delivered the product there, actually the next one that I'll be delivering the product into is the so-called the chin apex, okay? or we call it symphysis menti. Okay, just delivering there. Now the filler has lidocaine, so later on it will be numbed. So I know Jericho, it's kind of like some discomfort there. Okay, it's gonna be numbed later on. So once I deliver the product there, I'll proceed to the chin apex. So as to the labium mentalis sulcus, you can place an amount of, for example, it can be 0.5 to 0.7. Then I'm gonna go to the chin apex. Okay. So some fibrosis because of the acne marks, acne scars. Okay. So this one here, a bolus technique only to the chin apex there. Okay. So some bolus. So push, you can push here like 0.3 to 0.5. Okay. So once we have placed our product here in the apex, I will finish the right side here and then we'll move to the left side. Okay. So up to the 0.5 mil, just a bolus. Okay, there you go. So I also combined the so-called like inferior border here. After the labium mentalis sulcus and the chin apex, I can work on the lower the border here, the mandibular border here. I'll make an entry point here, inferior. Then I'll place the remaining half of that one into this area here. I noticed also that Jericho has this kind of like double chin. Right, Jericho?
Yes, bro. There's no.
Double chin, okay. So for us to remove the double chin, this is one way to eradicate the so-called double chin. Okay. So this is a technique cannula. Okay. Again, expect some resistance because we have a lot of like acne marks. So we have some tissue fibrosis there, and then just deliver the remaining half mil of your bullocks into the border of this chin area. Okay, so delivering gradually. Okay. Again, for our injectors, we wanted to avoid the mentalis foramen, which is in this area here. So I'm in the border. So the layer is subcutaneous layer. Okay. So we want to reach also the apex there. We want to deliver more product in the apex because we wanted anterior projection and as well as vertical lengthening. And then improve the vertical dimension. Okay, so once I can deliver this product up to this area here, just advancing. So I know Jericho is feeling the maneuvering of the cannula. It's kind of fibrotic here. And there you go, up to the apex. So once you have delivered up to the apex, there's just some resistance there. Resistance in the apex region. Okay, we wanted to deliver it into the... Okay. So after that, let's do a little bit on the jawline here. My technique will just be this one. I'll be just doing a needle method here because this is a good area here. Okay, so a simple method here will be just the injection method here. On the other side, we'll be doing the cannula method. Okay, so I'll just locate for the angle of the mandible, and for male again, we put it in front of that mandible angle. Okay, so we'll just be injecting. You can inject as much as half syringe here, then gently, slowly into this area. Okay, so let's proceed to the opposite side. we have done this left side here, injecting with our dermal filler. We'll show the result to Jericho when CSA Medical Aesthetics return. And we're done. So we'll show the result to Jericho. Here's the mirror, Jericho.
Oh my gosh, Doc.
There you go. So from a round shaped face to kind of like a square shaped face, a masculine jawline, and also the chin, a masculine chin, a square shaped chin, okay? So actually we used like not only 2 syringes, I had to add more of my hyaluronic dermal filler. So like it was a total of like a 6.5 ml of our hyaluronic dermal filler to achieve the letter L shape for the angle of the jaw, the angle of the mandible, plus also for the chin area. We want to do an anterior projection and at the same time lengthen the vertical aspect of the chin area. So what do you think, Jericho?
May baba na ako, Doc. Oh my gosh.
Yeah. Instant result, right? Yeah. Actually, right now, it kind of looks sharp a bit, but the filler will also blend and integrate inside. So we have a product material that has a rheological property of like with the viscosity, elasticity, and cohesivity. So somehow it will still kind of become like more of a better shape as time will pass by. And the filler attracts water, so it will still give a volume plus further definition. And actually, while I was doing the treatment, because the jawline area has this acne blemishes, there were like a lot of like tissue fibrosis. Kind of we're also doing a subcision on those acne scar areas. So somehow we were also treating the acne marks at the same time. So comment on that, on those, Jericho.
That's my fault. The acne marks,
acne
Doc.
problem, yeah. But so far, like there's an instant change, instant modification of the shape of the face of Jericho, because a while ago it was like a round shaped face and now it's a different shape of his face, more masculine, and we were like wanting this kind of like the letter L of the jaw plus this part here. We want it to be more of a muscular or a square shaped face. Actually for men, like we wanted this the chin area like parallel to the corners of the mouth. Like we make a vertical line from the corner of the mouth up to here. We place the filler in the inferior aspect, inferior border of the mandible here, okay? So we also wanted to fill in the labiomentalis sulcus there. We wanted to improve mostly the part of the chin, plus also create this L shape. Actually, I can still do like this, the body of the mandible, okay? I wanna like use 6.5 syringes. We can just do next time, because usually like when we fill in with this dermal filler, there's a normal sensation of heaviness. Like the following day, there's kind of like some pressure here on the lower part of the face, and Jericho is so busy, so I could like do like another like session for that one. So the body of the mandible, we can still do that and further improve the shape of his face. Okay, Jericho, speechless ka na.
Speechless.
I know. But so far during the treatment, like I can sense that you're feeling the pressure from the cannula, right? Like I was noticing you're twitching a bit. But so far, in terms of the experience, would you say that that's so painful, or it's something tolerable?
Tolerable po.
Yeah, it is, right?
The pricking only.
The pricking, oh yeah, when we did like pricking with the sharp needle to have that entry point for the cannula, you sense that. But it's just like the sharp prick.
Yung una po. Opo,
yeah, but it's
first.
tolerable also, right? And because men are like, when it comes to injections, men are more afraid of the needles.
We are.
Yeah. Okay. So thank you so much, Jericho. We'll
Thank you
still
din
do
po.
like a follow-up on you and check on you again, and we can still like do a session of this one. And for those who have any questions, you may email us at csaskinclinic@yahoo.com, our FB page CSA Medical Aesthetics, Instagram CSA Medical Aesthetics. Our clinic is located here at the Equity Shop, Pulong Maragol, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. Jericho, do you have social media account? They can follow you?
Yes po, you can follow me on Jericho Arceo on all social media accounts. Thank you
Yes.
po.
Thank you so much. And also, please do watch our other videos. Jericho also had a previous video, okay? And for those who have subscribed, thank you so much. And God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.